One of the things that I think we've all learned to do much better in the last 10 years is to listen to the elders and then work with each other. So the elders would say to us, why do I have to chase all over for these services? Why do I have to, if I go here, they send me there, and then they send me here? Why can't I just talk to one of you and you can take care of me? People who have programs tend to look in their area and become narrow in their thinking. The elders say, I need this, I need this, I need this, and they need a broad approach. They want a broad approach, and they want us to do better at delivering that to them in a comprehensive way.
We're fortunate to have several of our own transportation vehicles, but even the tribal transit works with us and comes over and helps for outings so that we can take more of the residents, so everyone as much as possible can enjoy those trips out shopping and out to eat and getting back out into the community.
So we have really good relationships with IHS providers. We work with community churches to provide the spiritual care to our patients. And then we may very well hook the family up with other resources on the nation that can help them to deal with the changes in their life. It's not a one-man show in any sense. We use a lot of the other organizations that are available to us.
Our tribe does not have Indian gaming, does not have any other resources that we can tap into. But we're doing it with partnerships and collaborations, and those programs that assist in the care of elders have their own funding, and they can contribute to the services for our center. Partnering and collaboration has been very good for us, and everyone is willing to assist the elders, even if it's using their own funding, which some of the programs can.
Here at Native Health, we have been trying to work the coming aspects of the Affordable Care Act and all of the changes in methodology for the patient-centered medical home. So part of that is integrating all of our services. While they were integrated before, we've developed new teams to capture primary care, dental, behavioral health, and work all that as part of their primary care visit.
Everybody that's under our skilled program gets case management, whether the patient feels like he needs it or not. And it's to just continue that communication between agencies, between the diabetic clinic, between the dialysis center, between Tsali Care Center, between Tsali Manor, and to make sure that we capture those changes in condition before it becomes an acute illness, if it's been a chronic issue, or if it's a whole new diagnosis or a whole new issue that keeps kind of flaring up.
So whatever those resources are in that particular community, there's always a way to find out if there's a gap, then how do we close up that gap and provide services to these community members? So there's always a way, and I guess a mechanism is different. It's going to vary from community to community, but it is, those services do exist. And sometimes another program scope of work may be folded in there. And when we talk and we begin to have those conversations, that's when we're able to learn more about what's available for our clientele.